Hello, my name is John Grimes, OSU Extension Beef Coordinator, and today I'm joined by Dr. Troy Brick, a veterinarian with the OSU College of Veterinary Preventive Medicine, and today we will be discussing the key points associated with feeder calf preconditioning. This picture shows some of the most valuable commodities available in the beef industry today: cow-calf pairs and productive forages. We are currently in the midst of historic price levels for all classes of beef cattle. The question needs to be asked: are we as producers doing what we can to produce quality feeder calves for the feedlot sector, the packer, and ultimately the consumer? Even with today's record high feeder calf prices, there are factors that will establish price differences with feeder calves in any market. One of these obvious factors is weight. History has shown us that feeder calf prices decline as weight increases, although the magnitude differs with market conditions from time to time. Sex of the calf. Buyers typically pay higher prices for steers compared to heifers and bulls based on expected feedlot performance. Health. Health-related attributes often have the greatest impact on price. Body condition can significantly impact feeder calf prices. Extremes on either end of the scale can result in discounts, either being too thin or too fat. Uniformity is very important. Sorting calves into uniform quality, weight, sex, and breed type typically results in a price premium. Lot size or group size. Stocker operations and feedlots want larger groups, typically truckload-sized lots of approximately 48,000 pounds for more efficient shipping. And horns. Horns receive greater attention after previous beef quality assurance audits showed carcass damages due to horn injuries. Polled feeders will receive a greater premium over horned calves. While gross sales for feeder calves are extremely positive today, there are still dollars available to producers willing to adopt certain management practices. This chart shows data compiled by CattleFax from summer and early fall 2014 feeder calf markets that indicates practices that add value to a calf price. Some of the things included are performance history. If you have a track record on how your animals have performed in the feedlot, that can give you up to a 4 to 9 cent per hundred or dollar per hundredweight premium. Natural or premium programs such as Never Ever or antibiotic-free programs or breed-specific programs like Certified Angus beef can give you definite premiums up to $9 per hundredweight. Certified vaccination like your CPH 45 programs or VAC 45 programs where you have a documented health regimen practice, those can be worth $2 to $6 per hundredweight, and of course pre-weaning before entering the feedlot is obviously a plus, $6 to $7 per hundredweight, again according to CattleFax. Most producers will ask the question whether preconditioning feeder calves adds enough value to offset the added costs. This question can only be answered by the individual producer. Here are a few items the producer must address to make preconditioning work for them. First of all, do you produce high-quality feeder calves that the market desires? Do you maintain adequate working and housing facilities to do preconditioning practices? Are you able to implement a recommended health and nutrition program? Do you have a marketing agent that can help you maximize sale price, get you more exposed to other buyers? Do you have detailed information you can provide potential buyers, and can you work with other producers to compile truckload lots? These are key factors to decide if preconditioning is for you. Adequate working and housing facilities can be a limitation for the producer that is considering the practice of preconditioning. OSU Extension has an excellent publication that is titled Cattle Handling and Working Facilities. It is available at the OSU Extension Beef Team's website. Click on the library button at the home page and look under the facilities category. Preconditioning programs usually include 3 components: weaning, a health program, and weight gain. Weaning allows the calf to become independent and consume nutrition on their own for growth. A health program enhances the immune system of the calf and prepares them for the next stage of production. Feeder calves also need to gain weight to overcome the stresses of weaning and health management practices. There are several important nutritional considerations to factor into a successful preconditioning program. First, when calves are weaned, make sure you offer a balanced ration of nutrient-dense feed and long-stem soft grass hay. Make sure you provide adequate bunk space of 18 to 24 inches per head. Make sure there's access to plenty of clean water and adequate minerals, and target a moderate daily gain of 2 to 2.5 pounds per day. There is no doubt that a sound health program is a key component of any successful preconditioning program. Now let's hear from Dr. Troy Brick, a veterinarian in the OSU College of Veterinary Preventive Medicine, on key points to a successful health program.
Preconditioning is a program that calf producers use to prepare young cattle to enter the feed yard. Research has shown that bovine respiratory disease is the most costly problem in the beef industry. Losses occur from treatment costs, premature animal death, losses from poor performance, and the added expenses from increased labor. Research has also shown that reducing stress on cattle will decrease sickness. We discuss stress quite a bit. And why does stress matter? During times of stress, the body releases cortisol. Cortisol adversely affects the immune system by reducing the body's ability to fight off diseases, such as respiratory disease. Stress is additive. This means that the more stressors that are placed on an animal at any one time, the greater the negative effect the stress will have on the immune system. Preconditioning is designed to reduce the stress placed on the animal at any one time. Vaccination and immunization are terms that are commonly confused. Many times these terms are used interchangeably. If I tell you that a calf has been vaccinated, it only means that the vaccine was administered to the calf. The term does not convey any type of protection. We generally assume that if the animal has been properly vaccinated, that it is protected. This is not always the case. If I tell you that a calf has been immunized, I am stating that the animal has responded to the vaccine and that the animal has some protection against the disease for which it was vaccinated. We cannot know if immunization has occurred unless we run specific blood tests to confirm that the animal's immune system has responded to the vaccine. Food animal vaccines are tools to aid in the prevention of disease or sickness. No vaccine can overcome poor management practices, such as poor sanitation, poor nutrition, or poor animal husbandry. There are many complicated interactions between our animals and their environment that can negatively affect the health of our livestock. No vaccine can provide 100% protection. What is a modified live vaccine? A modified live vaccine is manufactured by taking the disease-causing virus and changing it in the laboratory to a non-disease-causing virus. Once injected, the altered vaccine or altered viruses can replicate within the host to cause a natural immune response. This natural immune response leads to sensitization of the immune system to the real pathogen. When we discuss modified live vaccines, we typically think of the viruses that cause bovine respiratory disease, also known as shipping fever. Since modified live vaccines use live virus particles to stimulate the immune response, proper handling of these vaccines is very important. Modified live vaccines are very sensitive to disinfectants. A single drop of disinfectant solution can inactivate hundreds of doses of vaccine. Do not use chemical disinfectants, including soaps, to clean syringes or needles that are going to be used with modified live vaccines. Syringes and needles intended for use with modified lives should be boiled for disinfection. Modified live vaccines usually have two parts, a dry container and a liquid container. The two containers have to be mixed prior to use. Do not reconstitute the vaccine more than 1 hour prior to use. Keep the vaccine refrigerated until use. All the vaccine must be used or thrown away once it is mixed. Avoid temperature extremes as heat can kill the vaccine. This is especially important in the winter. Do not lay the vaccine on the dashboard of your truck with the defroster turned on high. This chart compares modified live to killed vaccines. An antigen is the part of the vaccine that provokes the immune response. Modified live vaccines have a lower antigen content than killed vaccines because the modified live vaccine will replicate within the host, creating more antigen. This is important because there is less of a localized immune reaction at the site of the injection. A good example of this is the injection site swelling that occurs a few days after administration of a 7 or 8-way clostridial vaccine. Cost is higher for the killed product, and killed vaccines typically require multiple doses every year because most killed vaccines have a shorter duration of action than the modified live vaccines. CMI is cell-mediated immunity. It's very important for thorough protection from the respiratory viruses. In the past, killed vaccines were considered the only safe method for vaccinating pregnant cattle. Today, both modified live and killed vaccines can be administered to pregnant animals. Just be sure to read and understand the vaccine labels. Injection site lesions are of major importance. BQA guidelines state that we should administer sub-Q injections whenever possible. Try not to inject more than 10 cc's per injection site with an intramuscular injection. You can inject up to 20 cc's per site with a sub-Q injection. Be sure to read and follow the instructions on the label of whatever you are giving. Administer all injections in front of the shoulder. We want to avoid injections into edible tissue. Never inject in the rump or back leg. Ear injections are okay. Sub-Q at the tail head is not a BQA site, but is the best alternative. In this example, we use a preconditioning program that vaccinates the calves 3 to 4 weeks prior to weaning, with a booster vaccine at or close to weaning. A modified live vaccine that aids in the protection against viruses that cause bovine respiratory disease are given in this protocol. I recommend vaccinating against 2 types of bovine viral diarrhea virus, or BVDV, infectious bovine rhinotracheitis, or IBR, also known as red nose, parainfluenza 3, or PI3, and bovine respiratory syncytial virus, or BRSV. An 8-way Bactrin will aid in protection against 7 or 8 different clostridial bacterial pathogens. Some take-home points from this preconditioning and vaccination section. Remember, just because you vaccinate does not mean that the animal has protection. When someone tells you that a calf has had all their vaccinations, it means nothing without specifics and signed paperwork. Vaccination is very involved, and protocols and label directions must be adhered to. Read the label, pre-slaughter withdrawals on your vaccines. Most require a 21-day minimum pre-slaughter withdrawal period.
Thanks, Dr. Brick. There is significant data that shows the economic impact of successful preconditioning programs. In Kentucky, in their recognized CPH 45 program, calves that were preconditioned sold for an advantage over non-preconditioned calves of a little over $5 per hundredweight up to over $8 per hundredweight during 2006 through 2011. In Oklahoma, in their Beef Quality Network VAC 45 program, calf premiums at the beginning of the program were down around $1.50 per hundredweight, but in more recent times, in 2009, premiums were over $8 per hundredweight, and in 2010, they were just under $8 per hundredweight. Also, Texas A&M University's Ranch to Rail program has shown cattle treated once or more in the feedlot are worth a little over $15 per hundredweight less entering the feedlot than healthy cattle. For any program of this type to be successful, it must be mutually beneficial for both the buyer and the seller. For sellers, The advantages are primarily more weight to sell and price premiums if marketed properly. For the buyer, there are definite advantages as well. Calves purchased that have been preconditioned should have reduced amounts of sickness, weight loss, and death loss. They should experience better performance in the feedlot and ultimately achieve higher quality carcasses. We end this presentation with a view of what we hope is the product of a successful feeder calf preconditioning program: cattle eating and performing well in the feedlot, which should allow us to achieve our ultimate goal of producing a consistent, high-quality beef product for the consumer. For more information on preconditioning feeder calves, you can contact Dr. Brick or myself at the listed contact information on this slide. Also, I would encourage you to go to the Ohio State University Extension Beef Team website located at beef.osu.edu for information on any other beef-related topic.